day, Bermuda. I'm here today with Dr. Lau, and we're going to talk a little bit about the medical practice that Dr. Lau operates, what he does for the Bermuda community, and of course in the context of COVID-19, how COVID-19 affected the healthcare in Bermuda, and so on. Good day, Dr. Lau.
Hello.
Please tell us a little bit about yourself.
Well, I am a general practitioner, and I am Canadian born, a Chinese, so ethnic in a way, although born and raised in Montreal, and I moved to Bermuda in 1999.
Did you come from a medical family? Did somebody encourage you to become a physician, or was that a decision you reached in the course of your career?
Oh, well, so yes, there are physicians on both sides of my parents, and my grandmother was the first female medical doctor in Malaysia, and then we have cousins and some uncles as well. But that wasn't, I would say, why I went into medicine. I think it intrigued me about the ability to help people and to combine science and art together in one profession. And so I'm delighted to have been able to choose it, and I've loved the work I've done ever since I entered the profession.
So it helps to have a fantastic pedigree, but the decision was all on your own.
You end up in CEGEP, which is in Montreal. It's just before university, and my grades were pretty good, and so I had chosen between dentistry, medicine, and biochemistry, and so it happened that I was accepted at McGill Medical School, and I took the offer. So that was some 28 years ago now.
Well, you mentioned something very interesting. It's about combining science and art within the medical practice, and that takes us into the medical aesthetics component of your medical practice. How does that enhance your practice? How does that enhance what you do for the Bermuda community?
Well, I wasn't only referring to the art of medicine in terms of aesthetics, but in practicing medicine, especially as a general practitioner, as a family physician, the art is in dealing with people, adapting to their needs, understanding, your own emotional responses to their position in life, how things evolve, and not doing things always by the book because that's what you were taught. So science is at the basis of what medical doctors do. So, there are studies and there are very clear guidelines how things should be done. Sometimes you need to go outside those guidelines to do what's recommend and to guide and help your patients to achieve their best health. So that's in terms of their general medical care. Aesthetics, yes, I'm a pianist, and I'm also an artist of sorts outside of my practice, and I enjoy and have appreciation for symmetry, and I enjoy the beauty of physics as it relates to lights and lasers, as well as the manipulation of facial features. And so the lasers are an additional part of the practice that I started about 14 years ago, and have since evolved, and we have 3 nurses who work in the practice and help to provide various high-tech treatments for skin quality, for appearance and beauty, and so this is just another dimension of the practice. So it helps, outside of general practice. However, the majority of what I do is simply allowing people to live the best life they can, and so that's perhaps, in answering the question, what I mean about the art of medicine.
I hear you. So as far as the aesthetics go, what's the most popular aesthetic procedure that you now perform?
Oh, okay. So for me, I tend to do mostly, the Botox, filler, and the technical lasers. The nurses predominantly do laser hair, laser genesis, pigmentary treatments with the lasers, as well as pills and micro needling, and there's a number of other practices and technology that we're going to be introducing over the next couple months.
So is there a psychological component to aesthetic procedures? Do you find that they enhance the patient's quality of life beyond merely improving appearance?
So yes, most definitely. I think that in order to give good results for people, much of aesthetic medicine is about managing expectations. So the treatments we do improve skin and appearance, wrinkles, fine lines, pigmentation, but it's critical to communicate what one can expect and what they can't expect. And I think we do the most service when we tell people that we can't meet your expectations, or we need to be sure that somebody understands what it can do for their appearance and what cannot, because people sometimes don't actually understand what the procedures do and what capacity they have. And that's a big part of what we do, not just the technical aspect, but the communication. And once again, that's where the art is to communicate and to understand what people are thinking in delivering treatments.
So it sounds like a challenging but rewarding work. And but there's got to be a component here that you perform and a component that the patient must perform in managing their care. So what would you say is the most important job that the patient has to do to help along their medical care and their health maintenance?
Sure. Well, so it's just like in the general practice. I think the patient needs to take responsibility for their own goals, and sometimes the biggest challenge I find for the patients is making their own priorities a priority, or their own goals a priority. Health being something that is critically important to somebody's well-being and ability to enjoy life, because without health you don't have very much else. You can have money, you can have friends and everything in the world, but without your health you don't have those things. So putting that as a priority, we as individuals, as human beings, are pressured by needing to pay bills. We're pressured by family or spouses and expectations about getting things done, and stress and getting to work on time and getting assignments in. So stress and life demands often detract from our ability to focus on health. So exercise, skincare, sleeping enough, managing stress are all important to an optimal result with aesthetics as well as general practice and getting healthy.
So that's what concerns your job as far as the patient care is involved. Does the patient have a job, though? And what is the most important job that the patient has in managing their own health care?
So I think various patients have strengths and challenges as well. And so it depends on the individual, but certainly a patient's health is their health and they have every responsibility. So it could be their responsibility to make it to appointments or, to book an annual. It could be a responsibility to being honest with their physician and to divulging and to communicating concerns, side effects, or outcomes that the doctor needs to know in order to advise appropriately. So there is a big responsibility for the patient in every relationship, which goes both ways.
So taking responsibility, it sounds like, is probably the most critical thing when the patient realizes their health is in large part up to them.
The patient determines their own health, and I think that, as I said, some patients, their health is good to start with. Others, their God has dealt them challenges to start, but everybody can improve from a starting point and build, and over weeks, months, even years. One of the most satisfying things for me is to see patients evolve, for them to improve, for their approaches and their goals and direction to go where they want them to. And so there are unforeseens, but at the same time, the journey has a lot of positive things. And one of the most satisfying parts for me is to experience vicariously, if you will, those ups and downs. And I get to travel with my patients, which is better than reading a book.
So what do you find is the biggest mistake that most patients make when managing their health?
I would say not putting enough time, priority, and consideration for their own health plan. Because as I pointed out earlier, I believe health is one of the most valuable things any of us have. And without it, you have very little. So I think the mistake some make is not making their health and healthcare a priority for themselves.
So if you had to pick the single best thing that one can do for their health, what would it be?
I think the single important thing for health would be to consider it every day as something that needs to be a priority, whether it be getting up and making decisions to exercise, to eat better, to take your medication, to go to the doctor, to get checked, or to make your mental health better and to be a happier person. I think just considering it is probably the most important thing, because many people go about life and life rules them before they can make any decisions to alter their course.
So in a way, take care of your health before you have to take care of your health.
That's correct. Yeah, anticipate it and manage it on your own, and decide with your physician what are the things that are your priority. Everybody's different.
So let's address the elephant in the room here. And we live in the new era of COVID-19. How did the coronavirus pandemic, affect your practice?
It affected us tremendously in that we had to adapt overnight. We never closed. We had to change protocols to allow people to come in, even through shelter in place, because when you see people in person, it's so much more accurate for many things. So telehealth was very helpful because many things such as prescription renewals or basic concerns that didn't require a physical exam or testing could be done through the telephone or video. However, we continue to see people. I wore a special N95 mask, a face shield. I even had gloves and a gown in for somebody who would come in with an allergy because they had a runny nose. I would take those precautions, and our reception staff would have to do the same. And then we were seeing people in the parking lot, giving them special letters so they could travel to the office, and the police wouldn't arrest them during shelter in place. So gradually things have been loosened. We still appropriately indoors space 6 feet by physically distancing. Everybody who comes in our door needs to wash their hands. That's a protocol. And then when we come within 6 feet, we wear masks, patients, staff, as well as the physician. And so for how long it will remain like that, we don't know. But every day and every week is a different requirement.
So both in light of the coronavirus pandemic, as well as generally, how do you see medicine and healthcare in Bermuda evolving in the next few years?
Well, the pandemic has been, in a positive way, a stress that has improved and shown the need to evolve. It's showed us that technology and adaptation are necessary to provide top-level care, because I think that doing things the old way just don't work anymore. And I think we're seeing that in every industry across the board, whether it be tourism, law, business, entrepreneurship. Medicine is the same. We need to get better at what we do. We need to know about what the advances are in order to provide for our patients so that they get the best care possible. And I think the direction is probably to have some form of telemedicine, hopefully reimbursed by insurance, still available. The future, I think, holds for the use of more electronic organization of scheduling, of communicating back and forth. And so that I find exciting, because I think that things can only get better. The stress of the pandemic has shown us that we need to do that in order to survive.
Okay, so Dr. Lau, on a personal note now, is it challenging for you to find balance between life and work?
Yes, at times it is. I think that the job is very demanding, being on call for patients with emergencies, and now with another couple physicians that we collaborate with, it makes it easier. However, I think that due to lack of time, and there's always things to do, reading, updating myself, going to meetings, take away from family life as well, and the ability to do your exercise and to eat properly even. Yes, it is challenging.
Even this interview is time consuming in a way. So what do you and your family like the most about where you live, which is a beautiful island of Bermuda?
Well, we like the safety. We like the friendliness of the people. And no one would, I think, argue that Bermuda is a paradise. So
I certainly wouldn't.
no, it's quite incredible that way. But really, I think in reference to what my family appreciates, I think that those are the two things: the friendliness of the people, and the safety. I think there's very few places where you can not lock your front door. I remember when I first got to the island 22 years ago, I'd lost my wallet at the tennis stadium. It had fallen out of my pocket. And then I came back a week later, and somebody I didn't know told me I'd lost my wallet, and they walked me into the back office and they gave it back to me. So
that's amazing. That's amazing. Only here, only in Bermuda. So, is there anything you'd like to tell our audience that maybe we didn't ask you about that you'd like to share? Maybe a few words of advice or words of wisdom?
Oh, well, I guess in reference to the elephant in the room is COVID. It's been so encompassing to all our lifestyle, affected us in such a way that is profound in many ways. I think that the advice I would have to whoever's listening would be to not fear it, and to understand that it too will run its course, and over time we'll look back in history as just another time that we lived through. So it's an experience to embrace, with its challenges, but also with opportunities that arise because of it.
Thank you, Dr. Lau. Until next time, this is Mike with Bermuda Health Magazine and Dr. Lau. Have a good day.